Dr. Bingham, tell me about the state-of-the-art equipment that you have here that takes a 3D scan.
Oh, we are thrilled to have in our office a 3D machine. That's a cone beam machine, or some people call it a CT scan, where we can get three-dimensional x-rays of your jaw, of your joints, all kinds of things that we used to just look at, and we'd have two-dimensional x-rays, and then we'd have now we can see deeper. We can see how many roots a tooth really has, or how many canals still need to be filled, or those kinds of things. Or we place an implant, are we placing in good bone, or have we got some issues in there? Where's the nerves run? Where do the blood vessels run? How close are we to them? Sinus issues, how close are we in the sinus? Those kinds of things that now we have some three-dimensional images of. So if they have a bend in them, we should be able to pick up or come closer to knowing what we have. Therefore, we expect it to be better treatment, being able to predict and to receive more effective treatment.
Tell me a little bit about, we've been talking a little bit about TMJ and TMD, which is something I have where your jaw tends to click, but tell me what those signs and symptoms are. We have the little skeleton man here that you can show me on what that is, and this machine actually helps look at that.
Oh, it gives us great images, much better images than we've had in the past. So here again, we expect to have some better diagnoses and therefore some better treatment that comes from it. But ideally, what happens is all of us have a piece of cartilage that's in this joint, and when this cartilage comes out of this joint, now we have a cartilage that's on the wrong place, and due to our clenching or grinding or a malocclusion or those kinds of things, we create a problem. And some of us, the side effects of those problems may be commonly headaches.
Yeah.
You're going to hear joint noises. Mm-hmm. You'll have a limited range of motions. It's kind of interesting because we'll ask somebody, oh, when you have a hamburger,
your jaw open up like a snake a little bit,
yes.
Unhinges.
Yeah. So when you eat a hamburger, you have to squash it.
Exactly.
You have to squash the hamburger till you put it in your mouth. So if you have a limited range of motion, or if it locks open or locks closed, or
mine kind of locks open sometimes, yeah.
So if it locks open or closed, or you decide that you've lost a marshmallow contest to see how many marshmallows you can put in.
Exactly.
So
that one I do all the time.
That one you do all the time. So anyway, those kind of things become an issue. Mm-hmm. Your speech becomes an issue. Those kinds of things become a challenge. We have some help with that. The same with airways. If we have an airway with somebody that snores or sleep apnea, those kinds of programs, all related to how your jaw functions or how your tongue sits. We have some answers for that.
And what are some of those answers for, like, sleep apnea? Maybe that someone's not sleeping properly and their tongue or jaw might be dysfunctional.
Well, the most interesting thing is the CPAP machine. We have a large part of our population that already know they have a sleep issue. They have an airway issue. And so it's been very effective. The CPAP machines are very effective at opening airways, giving people a better night's sleep, those kinds of things. But it's amazing how many people don't use a CPAP machine.
Yeah, exactly. I wouldn't even think of that.
You wouldn't even think of that?
No.
You wouldn't take that
into consideration, yes.
So, it's life or death, really, getting an airway.
Yeah.
And so the options are, we work with airways. And we have options that may be able to open airways without having the invasiveness of wearing a CPAP machine. So anyway, bring those in. Bring them in and talk to us about what issues you're having, and let us show you what kind of a simple oral appliances may be effective there.
And what are some of the oral appliances that you have here for those kinds of things, those issues?
Well, if anybody's done CPR,
mm-hmm.
you know that you have to open an airway. One of the things that we have with our appliances is that we put appliances in that open airways. Mm-hmm. And if you wear these appliances, the airways are open. Will it work for you? It's quite simple. It's quite easy for us to find those things out.
And what about someone like me with TMJ?
TMJ, pretty straightforward. We work with muscles, work with headaches, work with posture. We work with physical therapy, those kinds of things. And those things are very effective. And there are some that still are very difficult, very troublesome, And we hope that the three-dimensional x-rays will give us a better chance to see what it is that we need to adjust or do to help those kinds of people. So,
and those are great things that you offer here. And tell me where you're located at.
We're at 120 West Cache Valley Boulevard, suite number 200.
The Bingham Plaza.
The Bingham Plaza.
Easy to remember.
The two-story building. Most people can't find Cache Valley Boulevard. Sizzlers on the corner, 1250 North on Main Street. We're half a block west. Just come west towards Sam's Club, and we're right here.
And Dr. Bingham, thank you so much here at the Bingham Plaza. Easy enough, right?
It is. Bingham Plaza. Come see us.
Thank you so much.